name is Shelton-Sullivan, and we're here to talk about something that affects every one of us every day. Now, I want you to do something real quick. Show me your hands. Show me your hands. Show me your hands. Use them all the time, every day, right?
Right. Sometimes.
The Center for Disease Control says 2.2 million children under the age of 5 die every day from diarrheal disease and pneumonia. We're going to talk about hand washing today. Hand washing, very important. You would be surprised at the amount of diseases and viruses that get transferred because of the lack of hand washing. Hand washing could protect 1/3 of the children if they would, if they'd just been properly washed their hands. Worldwide, believe it or not, the use of soap is practically non-existent. Now, we're pretty fortunate, obviously, here in the United States. But worldwide, obviously, they don't have a lot of the conveniences we do. But even at that, here in America, hand washing education. I don't know if some of y'all have your kids. They've started a hand washing education in the school system to try to teach young people, very young, on how to wash their hands properly. The Joint Commission, which is a private firm that actually monitors all the hospitals, they say anywhere from 1.5 to 3.8 million infections occur every year, and there's 380,000 deaths linked to in long-term facilities, which we also reference as nursing homes. Nursing homes are one of the worst places that you can actually have those types of infections. A lot of them can't take care of themselves. So if you have a resident that's tending to an elder patient that's sick and they go touch another patient, so even at that, a lot of it's related back to the to the care workers themselves. But teaching the elder to properly hand wash is another important aspect. Hand washing prior to and after leaving rooms, having hand gel sanitizers, like at the hospitals, they have them outside the rooms. Education for the residents themselves. In the United States, 1 in every 130 patients become severely ill as a result of acquiring an infection in a hospital. We call these nosocomial infections. They happen inside the hospital. The numbers are staggering for the patients that actually acquire infection while they're in a hospital stay. Educating healthcare workers. You would think doctors, nurses would already know how to wash their hands properly, but you'd be surprised at the ones that actually do go into from rooms and don't actually wash their hands in between. One of the standards is to have a hand foamer outside every door. Like I say, you're supposed to foam in and foam out every time you leave. Educating your family members. As family members come to and fro from the room, trying to teach them how to use the hand sanitizers that come in and out, because they could bring germs in to the room, and then those also get transferred to other patients. In the Methodist system, where some of us currently work, they actually have classes to teach the nurses when they first get hired on how to properly wash their hands, and in some cases, and keep septic protocol, where it's especially important that we wash our hands. When something that affects us all, it comes more close. Article Journal of Applied Environmental Microbiology said that type A influenza is found on the dollar bill every 3 days. Type B hepatitis is found once a day. So always handle money. Money is important to us. That ought to bring it really into reality. So what can you do? Proper hand washing techniques. Wet your hands, lather them up well. You're supposed to lather them up for 20 seconds. Wash your hands, rinse them off. Actually dry your hands. They prefer actually using the hand dryers if you can. If not, dry your hands off. Use a different paper towel to actually close the sink off. And something else very popular are the hand gel sanitizers. They're quick and easy and equally as effective as you can use them correctly. So hope we all learned something today about proper hand washing.